Risk factors of for the prostate cancer is raise about rare, mostly rare, but before the 40s, about 60%, 65% over the age of over the age of 65, it increased by the age of 80 or 70, race mostly African American men in the diagnosed advanced state, uh, 2 times more likely to die in the disease, less common Asian American and Hispanic American men, and none of Hispanic white. Family history, third degrees related father or brother does not be related certainly. Nationality like North America and Northwest European and West Asian, African, Central South America. Genetically, BRCA1 and BRCA2 increase the risk, but accounts a very small percent of prostate cancer. And in fact, that obese diet, exercise can be a major factor. STD can be major factor related to the prostate cancer that can be increase of the disease in lost men. Uh, on cell levels, as you can see the picture of the cell, that the cell can be grow abnormal and increase of the cell, and the cell can be invade in dim a normal cell, which is grow over the normal cell and destroy the normal cell. Prostate cancer start and in the cell of the prostate. Some prostate cancer can grow and spread quickly, but mostly it's grow very slow. Sign and symptom of this disease with prostate cancer might be have no sign or mild or symptom that in early state the trouble, and that can be happen in early state, but in the late state can be trouble in the urinating, decrease the force of the steam of the urine, the blood in the semen, discomfort and pelvic area and the bone. Also have the bone pain, erectile dysfunction, and diagnosis can be the PBS with the prostate specific antigen, where with testing the blood and urine, the quoted test, rectal exam, the DRE that I mentioned earlier, and on the BPS also. Um, uh, my The PBS may make the cell the prostate glands, and most healthy men have a small amount of PSA, less than 4 manogram per milliliter in the blood. That should be where it is started diagnosis. Treatment can be watchful waiting or active surveillance, surgeon, radiation therapy, and cytotherapy, hormone therapy, and chemotherapy, and vaccine treatment, bone direct treatment that are related to the disease of the prostate cancer. And the complication, the urine can be severe, like from one another, but is in incontinence, erectile function, and then prevention of the prevent disease at a healthy diet full of fruit and vegetable. They choose a healthy food over the supplement. Exercise most day every week. Maintain healthy weight and talk to your doctor about the increase of prostate cancer if you have anything, and then painful or hard to urine over the night or wake up at night. Prognosis of prostate cancer can be 5 years. Relate survival rate about 99%, 10 years about 98%, and 15 years relate to 96%. It's very high percentage of this one. And compare and contrast of BPH and prostate cancer that I would say BPH they are common African American men, then Asian American men. Both disease are run into the families. You're more likely to get BPH or percent if female relate they have it, and urgent needs the urine, feel like urge to urinate many times during the night, trouble starting to urinate or having pussy to release urine, weak or troubling urine steam, urines flow that stop and start, feeling like your bladder is never full or empty, and also have the common of diet or exercise prevention. The prevention of both eating healthy fruits, vegetable, more protein on the fruits rather than animal, and then also have a exercise again. Oh yeah, and then here are the different. Having diabetic and heart disease it could be make you to get it vision. Also, same as the sun, painful burning urine, blood in urine, trouble getting, and then also a environment explore like Agent Orange, Vietnam War, the active element or watchful waiting. That's the difference between the game. And comparison of this one, as you can see that the diagram is more related that I just mentioned earlier. So, and for the case study number 7, that is AJ is a 53 years old married African American male who have come into the clinic for his annual physical exam. He has no specific complaints and denies of difficulty with urination, pain, and swelling. He has no drug or another allergen that is not currently taking any medication or another naproxen for the occasional headache. There is significant positive family history for cancer, as both parents, father and maternal grandfather had the history of prostate cancer. He has a 75 pack year smoking history. Smoking uh, and pack unit can be calculated for product the number of the pack of cigarettes smoked daily and number of years as a smoke. For example, in 75 years, 75 pack years can be in up to the result 3 packs smoked daily for 25 years old. He use alcohol occasionally. His diet is healthy and including a few saturated fats in many fresh fruit, vegetable, and whole grain products. History vital, as shown in the picture. And the question would be identify this patient 2 main risk factors for the person. Number one, the answer is number one, he is African American at age 50, that way is the prostate cancer. And number two, his okay, at the number one age, number two race, ethnically he black man, have a high risk of prostate cancer with the white man, the family history prostate cancer. And the question number two is AJ underweight, overweight, obese, or or he considered healthy a normal man? The answer would be he is fit too, weight 130 pounds, seem like a little weight, with AJ is BMI is 24.5, which is normal weight. He is normal weight. Question number 3, that's a good style because he mentioned earlier he eat a lot of fruit, fresh fruit in vegetable. Question number 3, which type of test is CPC likely to order estimate for the definitive diagnosis for this patient? The answer would be the prostate specific antigen, where you can look at the blood test or you can use the DRE, where is the dental rectal exam. Okay. And here is my reference and the end. Hopefully